Cervical mucus, a reliable sign of pregnancy?
Hello, and welcome everyone. Today, we'll be addressing a commonly asked question. Is the presence of cervical mucus a reliable sign of pregnancy after ovulation? This is a topic of great interest for those trying to conceive or those trying to understand their body signals better.
What is cervical mucus?
First, let's talk about cervical mucus. It's a fluid secreted by the cervix, the narrow passage forming the lower end of the uterus. The consistency of this mucus changes throughout the menstrual cycle, and it plays a key role in fertility as it can help sperm travel to the egg for fertilization.
How does cervical mucus change?
Now, you might be wondering, how does cervical mucus change? Prior to ovulation, during what we call the fertile window, cervical mucus often becomes clear and stretchy, similar to raw egg whites, which assists in the transportation and survival of sperm. After ovulation, the mucus usually becomes thicker and less in quantity, due to the hormonal shifts associated with the menstrual cycle.
Can cervical mucus indicate pregnancy?
This leads us to the key question: can cervical mucus indicate pregnancy? Well, it's important to note that changes in cervical mucus aren't a definitive sign of pregnancy. After a successful conception, some people might notice an increase in cervical mucus, which can be clear, white, or even slightly yellow, often referred to as creamy or sticky. However, these changes can also be attributed to normal hormonal fluctuations in a typical menstrual cycle.
Reliable signs of pregnancy.
So, what are reliable signs of pregnancy? The most accurate way to determine pregnancy is a positive home pregnancy test or a blood test at your doctor's office, usually detectable about 12 to 14 days after conception. Other potential early signs can include missed period, breast tenderness, increased urination, nausea, or vomiting, but these also can be related to other health conditions or the menstrual cycle. So, in conclusion, while changes in cervical mucus may be noticed around the time of a possible pregnancy, they should not be used as a reliable standalone sign of pregnancy. If you suspect you may be pregnant, a home pregnancy test or consulting with a healthcare professional would provide a more reliable answer. Always remember, understanding your body is a complex process, and every individual's experience can vary. I hope this video has been helpful. Until next time, take care.